You've probably seen the ads, the influencers, the shredded guys in their 20s saying, TRT changed my life. And maybe you're thinking, I'm tired all the time. My motivation's low. My workouts suck. Maybe I'm low T too. Here's the thing, you might be. But what's happening right now is a massive surge in guys under 30 going on testosterone therapy without understanding what they're doing to their bodies. This is the new shortcut. But it's not a hack. It's a hormone. And it comes with consequences. Let's break this down. First off, what even is TRT? TRT stands for Testosterone Replacement Therapy. It's a medical treatment for men and women who have clinically low testosterone levels, also called hypogonadism. The keyword here is clinically. That means blood work. That means symptoms. That means confirmation by a licensed physician. But that's not what's happening in 2025. Today, TRT is being marketed like a lifestyle upgrade. Feeling off? You might be low T. Energy low? Try testosterone. Not shredded yet? TRT will fix that. This messaging is everywhere, from gym bros to podcasts to TikTok. And the scary part? Some companies are handing out TRT scripts after a 5-minute quiz. Here's why that's dangerous. When you start TRT, your body gets a signal. You don't need to make testosterone anymore. Your natural system, called the HPTA axis, slows down. That's your hypothalamus, pituitary, and testes. It's your body's internal hormone engine. And once you're on TRT, it starts shutting down, which means stop TRT abruptly, your testosterone crashes. Stay on it? You're now a lifetime patient. Want kids later? Your fertility may be gone unless you're using meds like HCG, and no influencer is telling you that. Let's talk about fertility for a second. Testosterone therapy can reduce or even eliminate sperm production, especially in young men. You might feel great for a few months, then find out your body stopped producing sperm entirely. Some guys don't find out until they're trying to have a kid. And by then, they need expensive meds or fertility treatments just to have a shot. This isn't fear-mongering. It's medical reality, and it's happening more and more. So why are young guys doing it? 3 main reasons. 1, social media pressure. Men are being told that feeling tired, anxious, or unmotivated equals low T, but that's not always true. Sometimes it's stress, poor sleep, bad diet, too much porn, overtraining, even depression. 2, easy access to prescriptions. Some clinics, especially online-only ones, are handing out TRT with barely any testing. Some don't even check LH, FSH, SHBG, or free T. Just total T, and total T alone doesn't tell the full story. 3, instant gratification culture. We want fast results. More muscle, more focus, more libido. So if TRT promises all that, it's tempting. But long-term, it can backfire. Here's what most guys don't hear. You can feel low T symptoms without actually having low T. And sometimes you can have low T temporarily and fix it naturally. Sleep, stress, lifting, diet, nutrient deficiencies, these can all impact testosterone. Before jumping into hormone therapy, fix the foundations, get proper labs, work with a doctor who knows what they're doing, not a salesman in scrubs. But what if your levels are low? Then yes, TRT can be a game changer. If you've done everything else first, if you've been tested thoroughly, if you're monitored properly. For the right person, TRT can improve mood, energy, strength, and sex drive. But that's not what this video is about. This is about knowing the difference between clinical need and chasing performance. TRT is not a supplement. It's not creatine. It's not a shortcut to masculinity. It's a medical therapy that can help the right person and hurt the wrong one. So if you're under 30 and thinking about testosterone, ask better questions. Get a full hormone panel. Fix the basics first and get real medical guidance. Go to TRT.org. Learn what proper testing looks like and find out if TRT is actually right for you or if you're just being sold a shortcut.